It's one of the most feared diseases. We didn't know about it before about 1976, so it's apparently recently identified pathology. It belongs to the group known as the hemorrhagic fevers. So this is a virus for which there's no cure. There's really no treatment, although you can make it a little bit less. But the effect on the body is quite dramatic. You hemorrhage from most organs inside the body. You hemorrhage from most orifices on the skin. It has a case fatality rate. That's the risk of dying if you are a case, ranging from Lassa fever would be about 20%, that's the same family, up to the Zaire version of Ebola, which is over 90%. So a good chance of dying if you become infected. It's actually quite easily transmittable, not as much as an influenza or measles, for example, which is truly airborne spread. You could sneeze, either of those diseases, the virus can stay suspended in the air by itself. With Ebola, if the virus is inside droplets of water, if you do have a sneeze or there's what we call projectile vomiting or explosive diarrhea, the virus can be airborne for a very short period of time in droplets of water, and they quickly fall down. The main problem here is contact. It's the true meaning of the word contagion. So if somebody is ill, they've probably been vomiting and they have diarrhea all over the place, and that's the infective part. Now, in many of these areas, it's part of the tradition to wash the body of the relative. It's the duty of the surviving people. You wash the body. Now, here's a body that's absolutely a huge bacterial load on the surface of the body. Remember, even tears and blood and urine and all these fluids are full of the virus. So you can't release the body back to the family. Almost guaranteed, everybody who touches the body, who comes into contact with the body, or whatever the body's come into contact with, is going to be positive. So somehow you've got to prevent that. This gets them all very upset and angry as well because of their belief system. And so you can see the need for an anthropologist or a good, maybe a journalist or a writer, I don't know, who speaks Swahili or whatever the language is. So there's a lot of understanding and not just the science that's needed.